Hello, my name is Morgan Salisbury, and I'm a medical science liaison with Myriad, the makers of the GeneSight test. We are very happy to be here with you today. We know you care about your patients. You make decisions based on what you see and hear in your many years of experience. However, patients may not always respond to medications. Some may experience side effects like weight gain or insomnia, headaches, joint pain, muscle pain, and you may have to wait 4 to 8 weeks to assess responses to each medication, which can lead to months or even years of trying different medications. You may be finding that patients don't respond to the first medicine you prescribe. In fact, according to a large study, about 50% do not respond to their first treatment. Some may stop taking the medication because the side effects are simply intolerable. There are many challenges with medication treatment, including adherence, lifestyle, insurance and cost, and side effects, which may contribute to what might be the biggest challenge of all: trial and error. In fact, up to 70% of patients receiving prescriptions for depression medications are non-adherent, with side effects being the most common reason. If a patient comes back to you and tells you the medication isn't working for them, either the side effects are too bad or it isn't alleviating their mental health challenges, you have a few choices. You can change the dosage, you can add another medication, you can tell the patient to give it time to see if it takes the desired effect, or you can wean the patient off the medication and then prescribe another medication. With each change, you may wait 4 to 8 weeks to assess response to each medication, leading to months or even years of trying different medications. This trial and error process can cause frustration, wasted time, wasted money, and wasted medication. Yet the goal for depression treatment is remission. With every medication trial, the chance for remission, not just response, diminishes. According to an article in the American Journal of Psychiatry, only 37% of patients with depression achieve remission with the first medication prescription. For the second medication treatment, only 31% achieve remission. And with each subsequent medication treatment, their chances of success continue to decrease.
The most important thing is knowing which patients to switch out of their medications. I think a lot of times we spend a lot of time and energy either adding medications or sticking to a medication decision that we've made, right? Even though the patient may not be improving or is starting to show side effects.
There are a variety of factors that may contribute to a patient's medication failure or susceptibility of side effects. One of these factors is a patient's genetics. A patient may have a reduced response to a medication or side effects due to a gene-drug interaction. Or they could have a genetic variation that requires them to have a higher or lower dose of a medication. Now, traditional patient assessment does not uncover this information. This information is only available through pharmacogenomic testing. Pharmacogenomics helps use a person's genetic makeup to help inform medication selection and dosage.
The reason the genetic profile is important because it tells you each patient is different. Their genetic composition is also different. It's very hard to predict how does the patient respond to the medication without knowing their genetic profile.
Pharmacogenomic tests like the GeneSight Psychotropic test provide genetic information that is unique to each patient. Research indicates that up to 42% of variance in therapy response for MDD can be explained by genetic variation. Pharmacokinetic genes are involved in how a patient's body breaks down or metabolizes medicine. Variation in these genes may cause a patient to break down some medications more slowly or more quickly than normal. Pharmacodynamic genes can predict how the medication is able to work on the body. Variations in these genes may impact a person's likelihood of response or risk of side effects with certain medications. On the GeneSight Psychotropic panel, 9 pharmacokinetic genes and 5 pharmacodynamic genes are screened and included in the algorithm to identify genetic variation that may impact a patient's outcomes with certain medications. The GeneSight Psychotropic report also includes the COMT genotype for informational purposes only. GeneSight Psychotropic only includes genes in the algorithm that have been demonstrated to be clinically meaningful in multiple independent studies. Research has found that people fall into one of 4 general metabolizer types: the poor metabolizer, medication is broken down very slowly. Patients may experience side effects at standard doses. For the intermediate metabolizer, there's a slower rate of metabolism. Patients may have too much medication at standard doses, potentially causing side effects. For the extensive metabolizer, this is normal rate of metabolism. Patients have normal amount of medication at standard doses. Lastly, you have the ultra-rapid metabolizer. Medication is broken down very rapidly. Medication may be removed from a patient's system too quickly to provide symptom relief. Now, in addition to the factors you know, or your patients can tell you, you can have access to genetic insight with the GeneSight test. This can give you an objective tool that can be used in combination with other clinical factors to help inform medication selection. Let's hear from a couple of health providers on how they use the GeneSight test in their practice.
Up until GeneSight came along, much of what we did was trial and error. We might use some family history to guide us, possible prior history of treatments. But once GeneSight became available, we now had data, scientific data, that would help identify medications that might produce severe side effects, and therefore patients would stop taking them, or medications that might not work because of the way that patient's liver and the processes in the liver function.
And use this test only as a tool, a more scientific tool. So it makes me look good in front of my patients that I'm using scientific data to make decisions rather than just trial and error.
Using the information provided by the GeneSight report on your patient's genes, you can see how your patient may metabolize or respond to certain medications commonly used to treat mental health conditions such as depression, anxiety, and ADHD. The GeneSight Psychotropic test includes 61 medications commonly prescribed to treat depression, anxiety, ADHD, and other psychiatric conditions. Earlier this year, we added ADHD medications to the GeneSight test. This is important as more than 2/3 of individuals, children and adults with ADHD, have at least one other coexisting condition. In fact, according to the U.S. National Comorbidity Survey replication, adults with ADHD were approximately 3 times more likely to have depression and 4 times more likely to have an anxiety disorder. The process is simple. You or your patient collects the DNA sample by painlessly swabbing the inside of their cheek, either in your office or you can have the kit sent to your patients at home. The sample is then sent back to our lab in the prepaid FedEx envelope mailed with the kit. Within days, your patient's results are available to you on our secure portal. The report provides information about which medications may require dose adjustments, may be less likely to work, or may have an increased risk of side effects based on your patient's genetic information. This information is color-coded into 3 categories. Green means these medications are not associated with any known genetic issues that would be expected to change a patient's outcomes with these medications. Yellow means that there is a moderate gene-drug interaction. This means these medications may require dose adjustments in order to have the desired effect, or they may be less likely to work. Red means that there is a significant gene-drug interaction. This means these medications are likely to require dose adjustments in order to have the desired effect. They may be less likely to work, or they may cause side effects. The GeneSight report includes a wealth of information, far beyond the categorization of medications. All medications start out in the green category on the GeneSight test. When medications remain in this category, it means we didn't find any genetic variation in the genes we tested that is likely to impact the patient's outcomes for those medications. Based on an individual's genetic variation, a medication may be moved out of this category and into the yellow or the red category, depending on how significantly the variation is expected to impact outcomes with that medication. When this happens, the medication is labeled with one or more of the 10 possible clinical considerations, which explain the rationale for the medication's classification and can be used to help inform treatment decisions. For example, clinical considerations 1 and 2 reflect an issue with how the medication is metabolized. This means that the individual has a variation in one or more of the pharmacokinetic genes. This may affect how much medication is in the individual's system and may require a lower or higher dose, respectively. Clinical consideration 4 reflects an issue with the drug's mechanism of action. This means that the individual has variation in a pharmacodynamic gene, and this is predictive of a moderately reduced response to certain medications. Pharmacogenomic reports have a lot of useful information in them. Sometimes there's so much information that it can seem overwhelming. Now, as a family practitioner, you may be saying to yourself, I'm not a geneticist. But that is where my colleagues and I come in handy. At GeneSight, you have a team of PharmDs, PhDs, and MDs who are readily available to answer any questions that you may have regarding the report. In fact, after the first time you order the report, we suggest that you schedule a phone consultation with one of us, so that way we can go over the report, we can show you how to interpret the results, and then also how to relay that information to your patient. We offer numerous resources to help you explain the GeneSight report to patients and learn more about the test and pharmacogenomics, including white papers, clinical studies, and more on our website. And if you want, you can schedule an online or an in-person visit with one of our medical experts. Perhaps the most important fact that I can share with you about the GeneSight test is that it has been rigorously evaluated. The clinical validity, clinical utility, and economic utility of the GeneSight psychotropic test have been evaluated in multiple studies published in peer-reviewed journals. In fact, it's the only neuropsychiatric pharmacogenomic test backed by such extensive research. The largest ever pharmacogenomic randomized controlled trial in mental health, the GUIDED study, was published in the Journal of Psychiatric Research. The 24-week landmark study included 1,167 patients with moderate to severe depression who had failed at least one psychotropic medication included on the GeneSight psychotropic report. The results of the GUIDED study showed, while there were more symptom improvement in the GeneSight group compared to the treatment as usual group at week 8, this difference in the primary endpoint trended toward but did not achieve statistical significance. Symptom improvement is any change in the HAM-D17 scale and is based on the group average. There was a significant difference in the secondary endpoint of response. Patients who received the GeneSight psychotropic test experienced a 30% relative increase in response rates at week 8, compared to that treatment as usual group. Response is defined as a greater than or equal to 50% decrease in HAM-D17 score. There was also a significant difference in the secondary endpoint of remission. Patients who received the GeneSight psychotropic test experienced a 50% relative improvement in remission rates at week 8, compared to treatment as usual. Remission is defined as having a score of 7 or below on HAM-D17 depression rating scale. Subsequent analysis of the GUIDED study was performed on patients taking medications subject to gene-drug interactions at baseline, which includes the yellow and the red categories. Among those taking medications with gene-drug interactions at baseline, patients who were in the GeneSight arm had significant improvement in symptom reduction, response, and remission compared to treatment as usual at week 8. Outcomes continued to improve through week 24 for patients in the GeneSight arm. These data support the clinical utility of GeneSight psychotropic testing for depressed patients who may be failing their medication due to genetic reasons. Further, another study showed patients who received GeneSight testing saved on average $1,035 in total annual medication costs, compared to patients who received treatment as usual. The study also showed that patients who received the GeneSight test had a reduction in polypharmacy. 1 in 5 patients in the GeneSight group were on fewer medications by the end of the study. When patients were taking medications with significant gene-drug interactions, their total healthcare utilization costs were $5,188 higher per patient per year than patients on medications with no or moderate gene-drug interactions. The benefits of the GeneSight test can also be intangible.
One thing that I like a lot is that I feel like it fosters the therapeutic relationship with the patient, where you're able to have a conversation with them about, this is what your genes look like and this is what your genes tell us about you. And I think it gives buy-in where, I've had kids that have come to me and said, it's hopeless, nothing's ever going to get better. I've already tried 6 or 7 medications and I feel just as bad as I did before. And then they get their GeneSight results and they're looking at it in front of them and saying, Anne-Marie, all of the meds are in the red category that I tried. And they feel this hope, for the first time, that maybe this isn't the end and things can get better. So for me, that patient buy-in is really important. And then on the other end, for us as prescribers, we're able to say, okay, look at this SLC6A4 mutation. I'm not going to go through the list of SSRIs here. I'm going to try something with a more novel mechanism of action, and I'm going to get someone feeling better in 2 to 4 weeks instead of 3.5 trials down the line.
Now, we know that you're busy, and we know that you're probably thinking, how could I possibly add one more thing to what I'm already doing in my already short visits?
I came to realize that I'm too busy not to do it because, in fact, it saves me time. It allows me to be more effective in helping my patients. They don't need to come in as often, and then I can see other folks who are in need. So I find that, in fact, being busy is a good reason to do so because you're actually going to get information, which is going to make it easier for you to treat your patient.
Additionally, GeneSight is easy to implement in your practice. After you register with us to offer the GeneSight test, the process is simple. Step 1. You place your order on mygenesight.com, our secure online portal. Step 2. You or a member of your staff collect the patient's DNA sample with a simple cheek swab, or your patient collects the sample at home using our patient collection kit. Step 3. Your patient's sample is sent to our lab for analysis in the FedEx envelope that comes in the kit. After the sample is received, results are typically available in about 2 days. Step 4. Use the genetic insights from the GeneSight report to inform your treatment. We are committed to making the GeneSight test affordable for any of your patients who want it. Our goal is to offer your patients the lowest cost option available, and depending on their insurance, the maximum out-of-pocket cost may vary. 95% of those who take the GeneSight test pay no more than $330. Our private insurance billing process is as follows. We review your patient's insurance information to make sure it's complete and accurate. If a patient's cost after insurance could be more than $330, we will call them before processing their test. If we submit a claim, they will receive an explanation of benefits, or an EOB, from their insurance company in the mail. The EOB is not a bill, but an explanation of what's covered. After a final coverage decision from insurance is made, they will receive an invoice. Myriad Mental Health is proud to be a network for millions of patients in the United States. The GeneSight test can be used for a wide variety of patients. Those who are failed by a previous medication, those who are not responding to current medications, those with unwanted side effects, and others including seniors and those with liver damage. To conclude, the GeneSight Psychotropic test is a pharmacogenomic test that analyzes clinically important genetic variations, which may impact how your patient metabolizes or responds to certain medications used to treat mental health conditions, including depression, anxiety, and ADHD. The GeneSight Psychotropic test is a powerful tool to augment your knowledge, your experience, and your passion for your patients. It may also help them avoid a lengthy and difficult trial and error process.